I got involved in Aboriginal research and health research in general. I think roughly year 2000, 1999. And that was because I was starting to do my PhD, and the Assembly of Manitoba Chiefs, the Health Information Research Committee, had identified as an important topic for them social capital as a way of understanding social organization communities and its relation to health. And that was the topic I was going to be working on in my PhD research. So I met with the HERC committee at that time with Audrey Leader and John O'Neill, and that's where I started doing the work through the Manitoba First Nations Health Center for Aboriginal Health Research. And so that's what I had some prior involvement, but years ago in Argentina, in the south of Argentina, but that's with indigenous organizations in Argentina. And then I've continued also working quite a lot with indigenous health organizations in Colombia. So particularly three, and one is the Asociación Indígena del Cauca, the other Usacawen, and the third one is Anaswayu, which is the one that we are continuing to do a lot of work with. In fact, just came from a meeting that we're developing a proposal with AMC and MFMCAR to do a joint work with this organization in Colombia, Anaswayu. The way I've always worked, it's always in partnership. I mean, all of the studies I've been involved with came through interest of particular communities or First Nations communities or indigenous communities, and also through or organizations and the interest that they had in the research. So in a certain way, essentially they've been community-based research in the sense that the decisions of what to study have been done by the organizations themselves or the communities. And then in partnership we work together to develop, to fine-tune the research questions and also to develop the methodologies that we use. And most of the time also we've hired community researchers. You can't do something assuring that because you find out about something, things will change automatically. But that's what life is about. We always have to keep doing things and try to hopefully gather information that might lead to certain improvement in things. The work that was done with indigenous midwives in Guatemala, it was very important value work for them because they needed that some of the findings of that work and some of that to be able to gain more respect from the public health authorities in Guatemala. The public hospital was really kind of shunning these women who play a hugely important role in midwifery and delivery of babies in Guatemala in the rural areas. And so they used this information as a way to try to get a bit more leverage vis-a-vis the public health system. I believe you can't do this type of work without partnerships. It's just not, it wouldn't be serious, it wouldn't be valid, and it wouldn't be ethical. So that's thinking that we can do work with indigenous organizations and communities without a partnership, it's a no. That doesn't exist in my view. It shouldn't exist.